With obesity becoming nearly an epidemic in today's world, we have seen that the whole of the society has become very conscious and weight loss is becoming a hot topic of discussion. Now, which way do we need to take for weight loss? We have diet and exercise, which works very well if the person is around 10 to 15 kgs overweight. But if you need to lose around more than 40 to 50 kgs extra, then just diet and exercise will not work. You need to go in for something which is called as bariatric surgery. Now, bariatric surgery is a weight loss surgery. Unlike liposuction is a body contouring surgery. Liposuction should be used for people who have a few kgs extra, but they have a lot of fat deposited in localized areas like their arms, tummy or thighs. Now, the different types of bariatric surgeries which we have, that is the weight loss surgeries, are the sleeve gastrectomy, the gastric bypass, the mini gastric bypass. Then we have the banded sleeve gastrectomy and the banded gastric bypass. We also have the ileal interposition. Now, when you look at weight loss surgery, how do we decide between these different types of surgeries? How do we choose a surgery for a particular person? Suppose if a young person comes to us who needs to get married in the recent 1 or 2 years, then the surgery we will choose for them is a sleeve gastrectomy. But if this same person is having a BMI of more than 50 or 60, that it is not only morbidly obese, the person is super obese, then we go in for a gastric bypass surgery. Now, as we all know that obesity is not just a person being fat. We are worried about obesity, we want to treat obesity because obesity is associated with a lot of problems like diabetes, hypertension, that is high blood pressure, hypercholesterolemia, dyslipidemia, and also associated with weight bearing problems like knee joint pains, backaches. In the young girls and young men as well, obesity is associated with infertility. We have many patients coming to us who have been married for 3 to 5 years, 10 years and are not able to conceive. When they go to their gynecologist, they are totally cleared up, but they say just you need to lose some weight and you get pregnant. In such patients, when we have operated them and they have lost a substantial amount of weight, after that they have conceived without any problem. And once you undergo weight loss surgery, people have a myth that there is a problem for conception or the babies could have a problem, but this is not so. Our ladies have delivered normal babies and they have had normal deliveries. Now, when you come across a person who is morbidly obese, severe obesity and also having diabetes and cholesterol, then the surgery which we choose is the gastric bypass. This surgery, everybody fears that once you undergo this surgery, you need to take vitamins and supplements lifelong. You won't be able to eat properly, you will be vomiting all the time. But this is not so. After the surgery, for the 2 weeks, we need to take some precaution. You need to go on a liquid diet, followed by you take some vitamin and calcium supplements which we provide for you, and you also need to be high on a protein diet because many people are worried that you may have a lot of muscle sagging after weight loss surgery or a lot of hair loss. But if you take your supplements properly and if you take your protein powders very regularly, then you will not face these problems. Also, you need to visit your doctor very regularly so the doctor can guide you regarding the various exercises during your weight loss journey. Now, there is something else which I mentioned is the banded sleeve gastrectomy or the banded gastric bypass. We all know when young people undergo surgery, there is a chance of them at a later age, around 20 years after that, gaining weight. So, that is why along with the sleeve, we put in a small ring which is called as the phobie ring. Now, this ring prevents the stomach from expanding more than what is required so that they don't regain weight at a later date. Similarly, we put in the band for the gastric bypass as well. So when you do the banded surgeries, we have seen that the weight loss is much better within the first year and the maintenance of weight loss over subsequent years is much better. So if this surgery is done through small tiny keyholes, your hospital stay is just for 3 to 4 days and you can get back to work within a week. Now, we see diabetes in obese patients as well as lean individuals. Now, initially we were doing this surgery for obese diabetics, and after this surgery, even before they lost a single kg of weight, they got out of their diabetes. So then we said, why not give the same opportunity to the lean individuals as well? So even if you have around a few kgs extra, around 10 to 15 kgs extra, this surgery can be done on diabetics. Even if you are on insulin, but you need to make sure that you are a type 2 diabetic. the treatment which you would be taking could be either oral hypoglycemic drugs or you could be taking insulin. Once you've done the surgery, the very next day, or maybe it may take maximum a week, you can be out of your insulin and you can be out of your oral hypoglycemic drugs, and your sugars will be maintained normally. And these results can be achieved lifelong if you just have a little diet and a little exercise in your lifestyle. Now we have certain patients coming to us who are diabetics, and they have the diabetes has already affected their kidneys, which means that they are already passing protein in their urine, because the kidneys are affected by diabetes. In such patients also, when we have conducted this surgery, within a month or maximum 3 to 4 months, their kidneys are totally normally functioning. That means they are not passing the protein in their sugar. That means the nephropathy which diabetes causes, that can be reversed totally to normal if you come during the early stages. Now, we've also done this surgery on patients undergoing kidney transplant, who have already undergone kidney transplant. Now, diabetics undergoing kidney transplant, the diabetes is also going to affect the freshly transplanted kidney. So, in such patients, if we get this surgery done and you're out of your diabetes, the life of that transplanted kidney will work for longer years.